Hi, this is Vipul Gupta, fellow in training at Buffalo, in University of Buffalo at New York, reporting for Fitsonthego news team blog, and I'm at ACC 2012. I have with me Dr. William Boden from Albany Medical Center. Dr. Boden, what would be your advice for fellows who are in training and who are graduating going into a cardiology career?
Well, Vipul, I think that if you're interested in getting into a career in academic cardiology, I think you have to be very selective about picking a program, first and foremost, where you know that they have an established track record in research. I think the most important thing for a fellow is to be able to find a mentor, find somebody with whom the fellow can work, to be able to develop a plan for being able to conduct some research. It's not easy to do in the context of a fellowship because you're busy. So I think you have to be selective and make sure that you don't get into a program where that's not being offered or is not available to you. So I think being very selective and being careful about making sure that you choose a program where you know there's an opportunity to do research is probably the best advice to give.
Dr. Boden, another question. What would be your advice for interventionalists who are going into a career now?
For interventionalists who are going into a career, I still think it's going to be a very important career path because we're seeing that there are more and more advances in terms of catheter-based therapeutics, and of course, exploding onto the scene are trans-catheter approaches to aortic valve replacement, which I think are clearly exciting, as well as in interventional approaches to managing patients with heart failure and arrhythmia. So again, I think it's a field that's going to continue to grow in part because cardiovascular disease continues to grow in the world, and with the twin epidemics of diabetes and obesity, I think that we're going to have a continuing need for physicians who are going into this career who can help to manage patients with ischemic heart disease.
Thank you very much, Dr. Boden. Thanks for all your advice to the fellows who are starting their career. This is Vipul Gupta from University of Buffalo reporting for the Fitsonthego news team. For more information, go to www.cardiosource.org/fit. Thank you.